Well, the cause of the antibiotic-resistant Klebsiella infections at the Thelle Mogoerane Hospital in Vosloorus was due to overcrowding. Well, that's according to the Minister of Health, Dr Aaron Motsoaledi. The infection has led to the deaths of 6 babies. Motsoaledi says that Gauteng needs at least 6 more hospitals to decrease overcrowding at its facilities. Of course, for more on this, I'm now joined by SABC reporter Hasina Gori. She has been following the story and has just come back from that briefing that took place today. Firstly, one of the reasons was cited of overcrowding. How exactly is Klebsiella contracted?
Klebsiella is a pneumonia infection, but unlike other pneumonias, it's not by someone coughing. It's from someone touching you who's infected and then touching a wound. And once again, that's where overcrowding comes into place. According to the minister that we spoke to earlier, Klebsiella is quite common in low to middle income countries such as South Africa. But what made this one so deadly is because it was antibiotic resistant. So the first strain and second strain of antibiotics were just not working, and that made it even worse. And then you had overcrowding as well.
Yeah, it's a tragedy. Infants rather losing their lives. Just take us through what measures have now been put in place, at least in the interim, to stop the situation.
So as you said, infants have lost their lives. 11 babies contracted Klebsiella in that specific hospital in Vosloorus, Thelle Mogoerane. So what happened was they were trying to mitigate it from July. Moving babies, isolating them, but this has not stopped the spread of it. So what they've now decided is to move babies, all new admissions, all infants, to the Nelson Mandela Children's Hospital. That hospital has just been opened recently. It has space. So right now, for the next 6 months at least, they're going to be moving children and new admissions to that hospital. The problem is there are other hospitals in Gauteng province, but overcrowding again. In that specific hospital in Vosloorus, a bed of a hospital ward of 69 was bedding 90 babies. That means they were short-staffed as well, which just added to the issue of this infection.
Yeah. Speaking of those numbers, we do know that unions had also brought forward a dispute saying that in fact not 6 infants had died, but in fact it was over 20. Just take us through the dispute and the clarity on that.
Last week when SABC spoke to DENOSA, which is the nursing union, they said that the numbers are 24. They claim there's been some kind of cover-up and documentations have been hidden. We've spoken with the health minister today. Last week we spoke with the Gauteng Health MEC as well as the head of hospital services. They all claimed at that time the number was 5. We've also spoken with the NCID, which is running the separate investigation, and according to them the number is 6 who have passed on and just 11 that were infected, but there's also 20 children that have signs of Klebsiella inside of them right now. They don't have the infection, they're not infected, but they do have strains of it within them, and that's where there's caution, and that's why they're also moving infants to other hospitals just to ensure that they can scrub down, they can desanitize these places, they decontaminate it to ensure that we don't have a spread of it once again.
Yeah, definitely. Thank you very much for your time this evening. That was Hasina Gori for SABC News, just giving us a briefing there, or rather the outlines coming in from that briefing, as well as the measures that are going to be put in place upon that Klebsiella outbreak that has been confirmed that it has taken 6 lives.